Welcome to Stories from the Field, Partnerships for Achieving Health Equity. My name is Casey Deems, and I'll be running this Dialogue for Health web forum with my colleague, Jeff Bornstein. Now it's time to meet the moderator of today's event, Dr. Carmen Rita Nevarez. Dr. Nevarez is the director of the PHI Center for Health Leadership and Impact, which runs the National Leadership Academy for the Public's Health, the Director of Dialogue for Health, and the Senior Vice President Emeritus, External Relations and Preventive Medicine at the Public Health Institute. Welcome, Carmen.
Thank you, Casey. Welcome, everybody. Good morning, good afternoon, wherever you are. This is going to be a really interesting web forum today. We've got actual stories from what people are doing in the field and how this all relates back to achieving health equity. This is such an important area, and I'm really looking forward to listening to the stories that people are bringing to us today. Remember that you can ask questions via the Q&A, so please do place them in there, and we'll get to them as we can. Let me have the next slide, please. So I'll be introducing our panel, and then at the very end, we'll be doing some notices of upcoming events and closing. Next slide. So just for those of you who aren't familiar with us, the PHI Center for Health Leadership and Impact builds healthy, equitable communities, creating sustainable impact at scale. We're a public health do tank that helps individuals and teams transform their vision into data-driven strategies. We're a trusted partner to governments, nonprofits, and social change organizations committed to health equity and multi-sector partnerships. We improve health outcomes at scale with dynamic tools, deep expertise, and cross-sector collaboration. I think that what you'll get to see in the next hour is some of the results of the work that we've been doing together, both through the Public Health Leadership, the Academy for the Public's Health, but also just the incredible talent and drive and purpose that comes from the people who enter the Academy and who want to take their work to the next level. So next slide, please. Today's panel discussion features leaders that have strategically formed partnerships that advance health equity in their communities. Let me start by introducing the panelists. Our first panelist is Miguel Vasquez, who's the Health Equity and Urban Regional Planner for Riverside University Health System Public Health. His degree is a bachelor's in urban studies and planning. Over the past 2 decades, Mr. Vasquez has provided professional planning and community development services to the private, public, and military sectors. His role at Riverside University Health System has been to strengthen the integration of planning and health through collaboration with non-traditional partners. The American Planning Association and affiliates have recognized his work and leadership with numerous awards, including the 2018 APA President's Award and the 2020 APA California Distinguished Contribution Award. He is also a recipient of the 2021 Dale Prize, and he's an alum of the California Academy for the Public's Health first cohort. Our second speaker is Ana Marie Medina. She's the Director for Corporate and Community Relations, University of Arizona Health Sciences. Her degree is a master's in business administration. She has spent the last 20 years working in community engagement, from the mayor's office to corporate and community relations for the YMCA and the University of Arizona. In addition, since 2004, she has served in the role of co-chair for Activate Tucson, a community collaborative focused on improving the well-being of her community and its members. Her degree is focused on business, but her passion is in community organizing and empowerment. Ms. Medina is an alum of the National Leadership Academy for the Public's Health fourth cohort. And our third speaker is Ella Green-Moten. She's the administrator, Community-Based Organization Partners Community Ethics Review Board, and the executive consultant and co-chair of Flint Jeunesse partnership, Health in Our Hands project. Ms. Green-Moten has an extensive background in public health advocacy, public health policy, community-based participatory research, and programming, spanning over the past 40 years in the city of Flint and surrounding areas. In addition, specific efforts in public health ethics have focused on providing an awareness at the community level, developing and elevating the community voice, and advocating for community inclusiveness at the state and national levels. Her areas of expertise include facilitating community academic practice, partnership building and sustainability, developing, managing, and evaluating community-based projects, and training programs for graduate students, community members, as well as middle and high school students, partnering with community-based organizations, schools, and public health agencies. She's currently serving as a community-based organization partner, Community Ethics Review Board administrator, and executive consultant, and co-chair of the Flint Jeunesse Partnership Health in Our Hands project. She works as an independent community academic consultant, working with other academic institutions nationally that are engaged in community-based participatory research with their local communities. She's an alum of the National Leadership Academy for the Public Health 10th cohort. So this is a very exciting group. I really look forward to this discussion, and I want to ask you to change the camera view now. Thank you. Thank you. Let me start with the first question for you, and we'll just go in the order that I introduced you. What has been some of the most important lessons learned while working to address issues of health equity in your community? Miguel?
Yes, good morning, Carmen. Good morning, everyone. Thank you so much for this opportunity to share some of my experiences as a result of being part of the California Leadership Academies for the Public Health. What I like to begin by saying that while the name of my organization, which is the Riverside University Health System Public Health, may sound like I'm in academia, we are actually the Department of Public Health for Riverside County. And our department is one of the few departments in the nation that early on, I would say about 10 years ago, they hired me, an urban planner, to work on the intersection of planning and public health. And the reason for that is because the built environment has a significant impact on health outcomes. And traditionally, public health hasn't been focused too much on that until just in the past decade. There has been a significant movement that has grown in which planners are now speaking more intentionally about public health. So the lessons that I learned throughout my journey as a health equity planner in the public health department has to do mainly with my transition of what I would say being a technocrat, meaning knowing all the different ways in which we traditionally have planned our towns, into a more humanistic approach. And the humanistic aspect really comes from being part of a public health department, because everything that we do is based on making people's health optimal. So that transition really began by having understanding that planning cannot have successful planners without thinking about public health. And part of that journey included or has included working with young people. So one of the lessons that I learned is that we need to be intentional about investing time and resources in leadership development of young people. And the reason for that is because as generations keep moving through time, we need to ensure that those that are coming into the roles of being able to make decisions for the future of our communities are prepared to address public health into into decision making. And I have a few examples of what that looks like, and I can just cite one, and that is the story of this young woman who actually last year ran for becoming a mayor in the city of Coachella. Well, that individual 10 years ago was a high schooler who was part of a working group that I was leading through our Healthy Communities grant by the California Endowment. And today she is still in touch with me. And recently I invited her to be part of our board of directors at the Inland Empire section of the American Planning Association, because she comes prepared with actually equipped in the non-traditional sense of doing her work as a community organizer, which is the second lesson that I learned, the power of community organizers. Community organizers have this systematic way to connect with the communities in ways that are much different than bureaucrats like myself working in planning departments or transportation departments can. So being able to tap into that power is transformational. We were just at a meeting the other day, and we were talking about legislation for housing policy in our legislator at the state of California. And the bills that were presented by the person who leads that program, they focus mainly on infrastructure bills. And right away at the end, the one thing that she said that I thought was really powerful was, well, I think it's great that we're looking at bills that relate to housing development and warehousing siting, but we also need to look at bills that are addressing environmental justice, which is one of the things that our group hasn't really explored much. So that is where the sweet spot is, being able to tap into young people's energy and desire to improve their communities and combine our work with community organizers.
Thank you, Miguel. Anna Marie?
Thank you, and thank you for having me. I'm going to make a disclaimer, just like Miguel did. Although I am at the University of Arizona in corporate and community relations, I have been at the helm of Activate Tucson, a community coalition, since 2004, and that's really where my passion lies. My job at the university is to bring in that human connection. I live in the communications department, and they're all about, stories about what are our researchers doing and what's happening at the university. My job is to build relationships and bring those stories to them so that they can see how what we're doing at the university connects to the community. But in terms of Activate Tucson, I started with a leadership academy as part of a team that was developed in part for our health department getting its accreditation, and also in applying for the Communities Putting Prevention to Work grant back in 2010. And Healthy Pima was a coalition that was built out of our Activate Tucson team, plus bringing in a lot more health department partners. And our focus was really on accomplishing everything that had to do with health equity. And that has been our focus with Activate Tucson. We have gone from being a team that works on programming and events to really being an advocacy committee focused on health equity in all aspects across our community. And so being part of the cohort with the academy, the lessons that I think I learned and have learned over the years have been very similar to what Miguel was talking about in terms of making sure that you're hearing the right voices. You need to make it possible for every voice to be heard, and really look and find the barriers that are keeping people from being able to speak their truth and to share with you the challenges that they're having. And remove those barriers so that all the voices that need to be heard are at the table before decisions are made. You need to be able to have those powerful allies, not only in positions of power, but in community organizers. Some of the most powerful voices come from the community members who are experiencing every day the challenges that they faced in living a healthy lifestyle, whether it be safety in their community, access to healthy food, places for their children to be able to play outside without being worried of any dangers. And make sure that when you're talking with your allies who are in positions of power, providing them with the messaging and the data that they need so that they can use that information when they're speaking on your behalf. And so those are probably two of the strongest lessons that we've learned over time, is making sure all the voices are heard and that you have the right allies from both the community and from positions of power. Thank you.
Yeah, thank you very much. Ella, would you like to tackle that one?
Absolutely. And thanks again for the invitation to participate in this discussion. I want to start first, though, by acknowledging my team members. Our returning cohort 10 fellows are April Brown from Detroit, Jahan Ayash from Detroit, Lorena Bisha from Lansing, and myself based in Flint, Michigan. And because we were invited to do a second year as fellows of cohort 11, we've welcomed two new members to our team, Laura Dewberry from Detroit and Greg Pitts from Grand Blanc. And we are all members of the Michigan Public Health Association. Just to give you a little bit of background, we chose to focus on a population health project to address the social determinants of health and quality of life of Black and Brown communities of both Flint and Detroit, with an overall goal of creating and disseminating an accessible and easily adaptable education toolkit to aid in identifying and changing some of the negative narratives that exist, creating counter narratives from the lens of Black and Brown communities. One very early conversation that we had as we began this journey looking at health equity, and specifically in some of the conversations on the ground in Flint addressing the COVID-19 pandemic, we recognized that it wasn't just about health equity, but that we were actually looking at racial equity and inequity. We also recognized that much of the work that we were able to do or would be able to do as fellows and members of the Leadership Academy for the Public Health family is informed by the work done on the ground and in our local communities. And so we decided to address the inequities and injustices that exist in both Detroit and Flint, which are two very hard hit communities in Michigan. So a couple of very important lessons learned, I think, was just acknowledging that while we are all very strong and opinionated people, we are very good at listening to each other and making changes in our thoughts and our position. That the importance of being able to be coached, accepting feedback, making adjustments, that it's important to appreciate and celebrate even the small accomplishments, and also recognizing that this is a huge undertaking and that we're able to actually approach this challenge in the same way someone suggested that we might eat an elephant. And I'm not advocating that we harm elephants, but the thought was to do it one bite at a time.
Those are really good thoughts, and I didn't for a moment think that you were speaking against elephant populations.
I love elephants.
They're amazing. They're amazing. They can teach us so much. Okay, Miguel, I'm going to go back to you for a second and ask you to talk a little bit about partnerships. What partnerships have you found to be really critical in expanding your health equity initiatives?
Yes. To answer that question, I like to begin by acknowledging my involvement with the American Planning Association, which is a national organization of urban, city, county planners, environmental planners, transportation planners, anything that is related to building or communities and preserving or open spaces as well. That has been a very important and crucial organization that to the day supports my work in various ways. And in fact, today I noticed in the list that Anna Ricklin is here, who was the lead person at the APA, Healthy Communities Program. And she was one of my earlier collaborators on discerning what healthy communities is and how health equity is part of that. What APA does for me, it provides me or has provided an opportunity to stay engaged actually at the international, the national, the state, the regional, and local level to being connected with individuals who are actually like-minded and pursue the same kinds of goals, and they have the same sort of mission that we have in public health. So APA has been an instrumental organization. Currently, for instance, at our state level, we are in the process of organizing a one-day conference during the main conference of the APA California chapter, which is going to take place in Orange County, California in October. We're planning a full day filled with sessions related to health equity so that planners who attend this conference actually begin to, some of them need to think initially, what is health equity? You know, they need to answer that question. There's different levels of where our planning community is in terms of health equity. So for some, actually, health equity can be an inconvenient truth because there's some very difficult things that we need to discuss. And when we look at the social determinants of health, for instance, if we want to work in a sense that we can address the root causes of why is it that we don't have enough affordable housing, or why is it that we have an explosion of homelessness? Well, we need to talk about the history of this nation and things related to oppression and things related to a ripple effect that is the result of a conquest, if you will. And I don't need to go into what that looks like today, because we've seen it in the past few years. And I think there's many opportunities to transform the narrative. And to do that, we need to continue to coalesce and form new networks. So just about 2 years ago, excuse me, actually, no, maybe like 4 or 5 years ago, we started with this idea of developing a national healthy communities platform. And that idea actually transformed into a project that we completed 2 years ago called Planning for Health Equity, Advocacy, and Leadership. And it was done by a coalition of about 80 professionals from the fields of planning, architecture, engineering, artists, community organizers, and we developed a set of principles to do just that, to plan for health equity, advocacy, and leadership. And just to give you a glimpse of that, what that looked like, Anne Marie's comment early on when she said that we need to listen to all voices, that's that. Simple principles that we must remember and we must follow to be able to advance our health equity work.
Thank you. Anne Marie, same question.
So it's wonderful to follow Miguel, because I can build off of what he was saying, because you know, when we talk about partnerships here in our community, some of the most critical partnerships we have had are with our planning departments, our Department of Transportation, our Department of Parks and Recreation. Those have been instrumental in transforming the policies, systems, and environments that we have here in our community to be more equitable and to really look at how are we creating environments that make it possible for everyone to live a healthy life and have access to what they need to do so. And that gets back to the health equity issue, is that it's not equality, it's equity. You know, some areas need more than others, and we need to not worry about giving everyone the same thing, but giving everyone what they need. And so over the past 10 years, we've really had great support from all of our city and county departments in advocating for those policies and systems that help provide equity across the board, and that they are now functioning with an equity lens. And we've had wonderful support from our mayor. Mayor Romero started off in 2007 as a very young Hispanic woman from the South Side who became a council member and is now our mayor. And she has been a huge advocate for health equity across her whole time, and is just make sure that all of her city departments look at things in that way. We also look at all of our community partners who are working in areas. We have a lot going on here in our community, and we want to make sure that everyone is working toward those same goals. And one of our great partnerships right now is with one of our school districts that is serves 97% low and reduced income and highly Hispanic and highly refugee population. And we're finding that the way our tax credit system, so you can donate to tax credits on your taxes and donate them to a school and get them completely as a deduction if you owe taxes on your state. And most people will donate to the schools that are in their district. And what we're working on is advocating for people to donate to the schools that are in need, and educate people on that they can give that money to a school that is in need rather than the school in their district, which may have everything it needs. And that's the grassroots of us starting to work at the state level on changing that whole policy on how that tax system functions, and making sure that all the money goes into a pot and then it's distributed equitably to the schools that need it the most. So I think really our partnerships, not only of the city and county, but on the legislative level, have been the most critical for us. And then of course, our community partnerships.
Yeah, very, very interesting that you could bring in the idea of partnering with your legislature. That is a big elephant.
It is.
Elephant to swallow, but glad you're moving that direction.
One bite at a time and one legislator at a time.
Good point. Good point. Ella.
Yeah, so there again, we recognize that it would be important to draw from those existing partnerships, and keeping in mind that our team, the Michigan Health Equity Team, is a state, and even more importantly, that those relationship-oriented partnerships that each of our team members were able to bring to the table were very important. We all have very strong ties in our communities, and we are connected with the different levels and sectors of work in those communities. I believe those cross and multi-sector collaborations are most important because these conversations bring in many of the voices and decision-making makers that will be necessary to see positive change. And I think what really makes that evident is in our first year, we hosted a webinar, and drawing from partnerships that each of us had already established, we were able to get some very heavy hitters at that event. Our lead person, April Brown, was able to invite a lieutenant governor, and he showed up. And like folks say in my community, he showed up and showed out. It was an awesome experience. So just understanding that partnership are so important. You do things in silos. You have to appreciate what's already in existence. And we realize that, you know, in our second year, we're still developing relationships and partnerships. We move this forward. In taking one bite at a time, we've decided that we will be working with the community health workers. I would love to work with them this year to really get some on the ground work started to try to make a dent in the negative narratives that exist in both Detroit and Flint. So that's just one area. Partnerships are so important.
Yes, thank you. Thank you. So I want to, before we get to the questions from the audience, and again, you know, please put your comments in or your questions into the Q&A because we are looking at them and we will be weaving them into the conversation. The last question is, how did the Leadership Academy for the Public's Health program model impact your team, your work, your multi-sectoral leadership skills, and your ability to address health equity in your community? Miguel?
Certainly. To answer this question, first, I want to acknowledge my team members, and that is Cristina Mendez, Gabriel Perez, and Karen Borja. I still keep in touch with Gabriel Perez and with Karen Borja, but just to give you a quick sense of our project, when we came together, we wanted to develop actually a leadership academy for the city of Coachella. And the city of Coachella is in Southern California, near the Salton Sea, where the Coachella Music Festival happens, just to put it into context. And we landed on creating different educational modules that the city would adopt. Now, that project stayed conceptual, but when we were debating what project we wanted to do, and I'll mention also that while I tell the story, that part of discerning what project we wanted to do was very helpful to have a coach, because our team had a coach that you provided, and through that help, we landed on developing that. So while our project stayed conceptual, it never was really implemented. The ideas transcended in different ways in my particular work. But rather than talking about that, I'm going to give you a concrete outcome of what happened. So one of the topics that we were debating was to focus on transportation, because Karen Borja at the time was a community organizer, and she was working on transportation issues for the Eastern Coachella Valley, which encompasses different unincorporated communities in Riverside County. Most of the people who live there are farm workers. Some of them do not have permits to work, and it's a very harsh environment. It's very hot, it's the desert. So that was her thing, right? But because our project was really localized just for the city of Coachella, we decided not to do it. Nevertheless, as a result of having those conversations with Karen and learning how the transportation system, when it comes to planning, works through my work at the county, she was able to build a coalition, which I was part of. And eventually, she was able to work with the county to develop a mobility plan with the residents and many other organizations that have transportation and mobility as part of their work. Just recently, our department pursued an application from Caltrans, which is the Department of Transportation, to build a program around what is called the Clean California Local Grant Program. We got $2 million. And for the application, we use the mobility plan that Karen led, because the community engagement that she was able to develop in collaboration with others, obviously, was just extraordinary. And it was exactly what the Department of Transportation, Caltrans, was looking for. So our experience with the Leadership Academy, they actually have some very tangible outcomes, maybe not as how we envisioned them at the beginning, but how we were able to learn how to build relationships, how to understand one another, how to know that we all have our own technical language, but in the end, we all wanted the same thing. And this grant is just a testament of how important being part of this Leadership Academy was, not only for me, but actually to get some change done where is really needed.
Thank you.
So I'll leave it at that.
Yeah, thank you. Thank you. Anna Marie?
So thank you, Miguel. And I also would like to acknowledge my team, Yamila El Kahat with the University of Arizona Health Sciences Library, Montserrat Caballero, who was with the YWCA, was Pima County Health Department in the YWCA, and the Jennifer Peters, who works in our rural health office at the University of Arizona. Really, the Academy, I think more than anything, helped us to better understand ourselves and others, so that we were better able to have greater impact on strategy, on leading others, on making connections, and even mentoring others. So many of them, including myself, we have all changed positions since the Academy. Yamila, interestingly, was the shyest one in the group, had very little self-confidence, and she has gone on to be a national leader in research and leading health equity within our southern region. And every one of them has moved on. We've all moved up to higher positions. And I think that what it helped us to do is have that self-reflection and mentoring that allowed us to improve on our strengths, to learn about the areas of weakness we had, and to build up on those areas. I have to give huge credit to our mentor, Dr. Arthur Chen, who was just phenomenal in guiding us and leading us and helping to point out areas of strengths and helping us to build those, and areas and how we could work on areas that we needed to. It was just a phenomenal experience, and one that I think had impact on all of us. And we still talk about today when we get together. Some of us are working together on some projects, others have moved on, but we're all still working on health equity in our own ways. And we still talk about the difference that the Academy made in our both personal and professional lives. So I highly recommend it to anybody who's considering doing it. It will have a great impact on you.
Thank you. Thank you for that. Thank you. Ella?
Oh, yes, and some of the same comments from our end here. The members of our Michigan Health Equity team have been impacted in several different ways, starting from our individual, our personalities and how we interact with others, and up to including allowing each member to understand what each member brings to the team, and understanding how to allow individual assets to strengthen the team. Being part of the Academy, we've been exposed to just so many different tools and resources that we are able to use and pass on to others. We are constantly encouraging our colleagues to apply and be part of this process. I also would like to thank our coach at the SLAM, and our guest coach, Mr. Michael Berg, who have spent a lot of time with us. And I have to say, for Kathy, she pulled us back early on, because we had this huge agenda that probably would take 10 years to do. And she looked at it and she was very cool about it. And she didn't say, don't do it. She sort of said it in a way that we all went, and made that pivot and change. So it's just been a life-changing experience, I think, for all of us. All of our team members are very appreciative being part of this process, and will continue to encourage others to join to try and be part or become a part of the next cohort. So it's been awesome.
So thank you for all of those comments. And I think just for the audience sake, one of the things I should mention is that the program does provide a year-long experience with webinars and meetings, various kinds of meetings to help promote and expand your learning opportunities. But one thing that each of you has mentioned is the role of the coach. And I think that a lot of folks contemplating this program don't realize that if they're selected, their team will have a personal relationship they will be developing with a coach. And that in so many ways, that coach, we hear this over and over again, that, you know, you hear some things in the webinars and you talk about some things with your colleagues on the webinars, but then the coach really helps you to bring it on home and to look at the things that maybe you didn't look at before in a new way, and to appreciate both the opportunity to learn about that and appreciate each other, the members of your team, in ways that you didn't appreciate each other. And to recognize and appreciate your opportunity to do some really important things in the world going forward. And so I just want to do a shout out to the whole coach structure, because I think it's just one of the things that sticks with everybody. And we keep hearing that over and over again when we go back and survey the participants. So I want to go on to some of the comments made in the audience and just sort of see if you have any thoughts or reflections about them. Let me just start with the first comment, which from David Dooley. Perhaps the cruelest form of inequity is the variability in the quality of parenting. Some children go home with parents who will engage in parenting behaviors and practices generally recognized as supporting their healthy development. Others go home with parents who will engage in behaviors and practices generally recognized as disrupting the healthy development of children. This variability has been a given for centuries. Should public health organizations be developing an entirely new parenting education that reaches everyone everywhere? Any of your thoughts on that? Miguel, we'll start with you.
Yeah, I can actually go wild. I think the whole system needs to be dismantled, everything. You know, I was looking at a tweet the other day related to housing, and typically when we think about, you know, our housing crisis, we have the tendency to focus on production, on number of units. And sometimes we forget about actually livable incomes that can help you stay where you're at without the fear of being displaced. But you know, the way our system works, it has to do with productivity and wages, and it's just microeconomics. And it's all kinds of, I think, concepts that are very difficult to grasp, like inflation, for instance. You know, it's just so hard to understand, especially if you don't have time to learn about inflation. Then if you don't learn about inflation, then how can you be part of solving inflation? Is somebody else going to solve it for us? What is it that we need to do? And that is just one small example that I think about in terms of our systems of oppression. Some of them are designed to benefit some than everybody else. I mean, that everyone else. So when it comes to equity, I think there's opportunities to re-envision all of our systems, including parenting programs. But we cannot talk just about parenting programs when parents may be overburdened with other inequities, maybe the loss of a job, maybe the loss of somebody from disease, maybe because there's no opportunities for uh, experiencing a healthy life in your community. So I'll leave it there.
I'll build on that. We had a panelist, we brought our legislators to one of our meetings, and to let them know the things that we were working on in our community, all of our partners. And the final legislator stood up and he said, you're talking about everything, all the issues that we have. And he says, it all comes down to one item, and that is poverty. If we solve poverty, we can solve everything else. And he said, that's what needs to be the focus, is how do we create environments where people can have what they need in order to live the type of life that they need to. And so when you talk about parenting, you're right, you get a lot of those parents are not intentionally providing environments where children cannot have a healthy environment. It's the stress that they're under from trying to provide just the roof over their heads and the food on the table. And so those things have to be addressed, and it's getting down to those social determinants of health, those root causes, and poverty is the number one issue. And I think until this country realizes that that is the thing we need to address first and foremost, I don't think that, we're going to have, we're just going to be constantly beating our heads against the wall, but we need to address the poverty issue.
Oh, you want to jump on that too?
Absolutely. And I can agree with both comments that were made. I think when I think about public health, I've been trained to think about it, health broadly. So I know that we have to think about other things other than just the wellness or the sickness of folk, right? And I agree that poverty is a huge issue, but I'm going to go a little bit deeper than that and say that until this country is able to address the institutional, structural, and systemic issues by racism, until we're able to address those things, we won't be able to eradicate all the other things, all the other ills that put our families in harm's way. So we can't, we have to address, we have to look at it, and we have to.
Thank you. So let me take this a slightly different path. How can leaders stay proactive in working towards health equity and simultaneously address the structural but urgent portions of the public health crisis that become more frequent? The writer also says that thinking about, you've got the water crisis in Michigan getting national attention, but also keeping in mind that we're expecting water crises in Arizona. We're expecting them in California. We're expecting, how do we juggle this? What's your thinking about how do we juggle what we know and what we can predict? Somebody want to jump in?
I will, and say that I think for a long time we've thought about doing one thing and doing it well. And I've always had a problem with that, because our stuff is so entangled and mingled that we can work on one thing and really get it looking really good. But if we haven't done anything with other 1,000 things that could impact that issue, we're still almost where we started. So I think we've got to allow ourselves to think in terms of allowing many, many, many things to happen at the same time, allowing different people to do different things so that we can carry all of this along at the same pace where we can really see a difference. That's just how I feel about it.
And Maria or Miguel?
For me, it's, I think for those of us that work in these fields, we have to have faith. I mean, it just comes down to the fact that we have to have faith that the work that we're doing and the continuing efforts will eventually have impact. And we need to keep working toward that and bringing new partners in and spreading the word and educating our legislators and our representatives on things that need to be addressed. And I did want to address Lucy John's comment about that poverty is not the end of the problem for health disparities. And I totally agree with you, Lucy. It's not. I know it's more of a outcome of the structural racism and other issues that we have had. And so we have to do, as Ella said, go back and address the root causes, and poverty is an outcome of that. But for me, you've got to have total faith that what you're doing is going to eventually work, and that will keep us moving in the right direction.
I agree with both speakers' comments, and what I could add to the answer is that we really need to tap into, again, the community organizers' power, because that is where the ear is to the ground. That's where the actual deficiencies are being discussed in a completely different way than the legislation may be talking about a problem. I think capacity building of community organizers is important. And just like the example that I mentioned about Karen, telling her about how the transportation planning system works was not it was not like a course that she had to take. It was more of a conversation, but she knew how to navigate the waters, how to talk to people, how to ask the right questions, and how to be persistent, and not just by herself, but with others behind her. So coalitions, I think, are going to be crucial in the future to be able to recalibrate our systems in address these imminent issues that are coming our way.
Thank you. So Miguel, one of the audience members is asking, what was the title of the guidebook that you had mentioned?
Oh, it's it's Planning for Health Equity, Advocacy, and Leadership. And I added a link to the chat.
Oh, thank you so much.
So you can just click on it and learn about it and see who was involved, et cetera, et cetera.
Very good. Thank you so much. One of the questions, we're getting the questions now at the end. So let me just, let me underline. Ella's last point was huge, particularly in rural places. All of our issues are so interconnected and our resources so interdependent that the only way we're going to make progress is to do everything holistically, to find the root causes of dysfunction and fix it all at once. It's daunting, but there's no other way. So that's going to lead me back up to, for our last question, just a comment and sort of a question. Miguel talked about the need to tear down the whole system. And just parenthetically, she agrees with that. However, as a community health worker, it's not within her power. She often gets discouraged with the paradox of knowing that the system was not designed to help specific populations in her community, and yet still trying to work with that system and improve it. Do you have any advice for those of us feeling this discouragement? Do you feel like the system is changing, even incrementally, for the better? So for your final thoughts, let's pause on this and give it some, give it some energy, some positive energy, hopefully.
Yeah, of course. And I can comment. And I think it goes back to one of Anne-Marie's comments that we have to have faith and hope. That's how we get the work done, because we have to stay dreaming or keep on dreaming that things will get better. That is what is going to get us from one milestone to the next one. And things are changing. Yes, things are better, even though it looks like a tremendous chaos, because it is. But within the chaos, there are wins that are happening all over the nation. They may not be as visible as the big news because it's the nature of our systems, right? I think it's important to be able to cope with those feelings of sometimes discouragement. I think it's important to go back and think again, how can we nurture the next generation of champions for health? Because this work is generational. It's not going to happen in 5 years or 10 years, but in 5 years and 10 years, those champions that we build, they're going to make their mark, and that adds to the collective, I would say, work that we all are doing to improve our communities.
So we're coming up on our last couple of minutes. Anna Maria, I'm going to give you a chance, and then Ella, and then we'll close out.
Yeah, I'll just go back to what Miguel was saying and really sort of circling back to my first comment about letting the voices be heard. I think that we are starting to hear the voices, and we need to enable people to be able to be heard. And the National Leadership Academy for the Public Health gives you the tools to be able to help those people to raise those voices up. And so it helps you to be able to help others. And the more voices that we can get sounding off, the more people will have to listen. Eventually, they have to listen if the voices are loud enough. And so it's our job to help those be heard and bring those people up. And so whether it's the next generation or the voices of those that are here now, we need to help and encourage them and support them in every way that we possibly can. And we will see change.
Thank you. Ella, you get the last word.
Because I know we're out of time, I'll say ditto. We absolutely have to continue what we're doing and just amplify it a little bit. Just keep it going. That's it.
Okay. Well, I like very much what you all have brought to us here today, the experience, the wisdom, and and really the kindness of your comments. I think that everything that you said was said with a great deal of love for the people that you work with, for the members of your team, for your community, and for your purpose. There's nothing like learning from people who are doing it on the ground. There's no experience that equals the power, that equals the voice and the potential. So I want to just thank each of you for bringing your stories to this group. And I'll just mention here that the applications for the program are opening up in August. And I absolutely encourage you, if you have any interest, fill out the interest form. The link is being shared in the meeting chat right now. So, it doesn't obligate you to anything, but it will help you to learn a little bit more about the Academy and get an opportunity to think about whether this is something that might work in the kind of work that you're trying to do. Next slide. I do want to just point out we have a couple of really excellent webinars coming up. Why Agile Leadership is Crucial for Impact, and then the application information session. So please just jot those down and come back to our site and do register, because I think there is a lot to be learned from the opportunity of being in part of a learning community that's really vital, as well as the opportunity to really be on the ground, learning where you need to go as a community. None of us have the pathway marked out for us. We all have to discover it and have to turn over a lot of rocks in the process. And I really just thank the panelists today for sharing some of that process with us and being a part of this important conversation. So to all of you that were listening, thank you so much for being here, and we hope to see you again next time.